How will the COVID pandemic affect flu season? Experts say Northern Hemisphere countries face an unpredictable winter as COVID continues to spread during the flu season. Countries in the Northern Hemisphere are facing an unpredictable winter as COVID-19 continues to spread during the flu season, experts have warned. Last year, when the government delayed COVID-19 infection by recommending various protective measures such as wearing masks, social distance, and blockade, the number of influenza cases dropped dramatically compared to the seasonal average. According to the World Health Organization, WHO, the number of cases remains low this year, but it is specialized as COVID restrictions have been lifted in many parts of the world. Children have returned to school and the coronavirus continues to spread. The House should exercise care for the people. An uptick of influenza cases could burden health systems already facing difficulties due to outbreaks of COVID-19. Generally, people recover from these symptoms without requiring medical attention, but the virus can also cause severe illness or death, especially in high-risk populations. According to the WHO, annual influenza epidemics are responsible for about 3 to 5 million cases of severe illness, and about 290,000 to 650,000 respiratory deaths. During peak seasons, an influenza epidemic can overwhelm health systems. Experts have said it is difficult to predict the severity of the flu season in the Northern Hemisphere, but some have warned it could be challenging this year. Last year, influenza activity was dramatically lower compared with the previous years in both the Southern and Northern Hemispheres. Due to the much lower number of infections in the past year, strains circulating this year can be more difficult for people's immune systems to detect, which makes people more susceptible to infections and it can lead to serious illness. Dr. Amesh Adalya, a senior scholar at the Johns Hopkins Center for Health Security, said people continued to take precautions against catching or transmitting COVID-19, which could lead to a milder flu season compared with those before the COVID pandemic. A lot of the people are still doing some of the mitigation measures from COVID-19 that had an impact on flu, like social distancing, wearing masks, being careful when they are in a high-risk setting, said Dr. Adalya. So I do think that flu is going to be more common this season in the Northern Hemisphere than it was last season, but I think it might be a milder season than the ones we had in the pre-COVID era, he added. Experts also warned that an increase in flu cases could overwhelm health systems in countries where COVID-19 hospitalizations are high. We have a proportion of people that are still susceptible to COVID-19 infections due to immune problems and not being vaccinated, Dr. Lenora Saxinger, an infectious disease expert at the University of Alberta, said. According to Dr. Saxinger, the influenza season ordinarily results in healthcare systems strained. Experts have said that much of the health guidance that has been introduced during the pandemic can help to mitigate the risk of spreading the flu. According to the CDC, the health measures that help to protect against the flu are: avoid close contact with people who are sick, stay home when sick, wash hands regularly, avoid touching the eyes, nose or mouth, and cover the mouth and nose. The measures against COVID worked excellently against influenza, Dr. Saxinger said. According to the WHO, the influenza season in the Southern Hemisphere this year was similar to the previous year. Dr. Soto Rifo said that different variables could explain the low rates of flu. In Chile, the vaccination campaign started having an effect. There were also mobility measures well established, and the use of masks was mandatory, Soto Rifo said. However, as summer starts in the Southern Hemisphere, and some measures are relaxed, Dr. Soto Rifo said there are concerns that COVID-19 cases concerns could grow. According to Dr. Soto Rifo, one challenge that Chile did observe during its winter was the rise of rates of respiratory syncytial virus, RSV, in children. This is a common virus that typically infects young people and can sometimes cause pneumonia. Children are good vectors of respiratory viruses, but keeping the measures in place helped, Soto Rifo said. For more health and COVID-19 contents, check the playlists in the description. Also, leave a like and comment for more.